So welcome to this podcast where we're going to just introduce some of the key figures who brought the Cytokine Signaling Forum into reality. And it's a real pleasure for me today to have Hans Bijlsma joining me, Professor of Rheumatology from Utrecht. And Hans, you've been in here from the very beginning. We're now 6 years old as an educational vehicle. I mean, you're one of the world leaders in delivering medical education in the field of rheumatology. You've pretty much inspired the creation of the EULAR School, but the Cytokine Signaling Forum, online education, it's been a very exciting journey for us. Tell me a little bit about just your current thoughts and feelings about what is the way for us to educate clinicians in this complicated world?
Well, that is not an easy one.
I never ask you easy questions, Hans. That's one of my jobs in life.
Because it's very much individual based at this moment in time. So I think that we have moved away from the classical textbooks with a lot of text to very short online courses. But that was step one, which we took about 15 years ago. And now we have realized that at the moment in time, especially the young people, only have about 7 minutes of attention to something we try to convey. So we have to reshape our educational materials. And at the moment we are actually doing that in the EULAR online courses. We are making it very small bits, trying to have it more like we are doing now, a podcast or something like that, but also being more interactive and also trying to stimulate the people to do things themselves. And we all know that the more actively you are involved, the better it stays. But now we also see that it's quite difficult, especially for the people of our age, to find the right way to give that kind of education. So it's very important now to bring in young people who really are born with the computer, who really are born with the iPad and the iPhone, who are completely aware how these things work. And we have to translate all the essential knowledge to that level. And we also have to realize that it's not necessary anymore to know everything by head. It's much more important to help people learning reasoning, to help people learning understanding, to think themselves. And if you want to know where that muscle is, you can go to your phone and you'll find where that muscle is.
I've heard you use the phrase a tsunami of information when we've been talking in the past. So what I think I'm hearing you saying is that we're using the online world, the virtual universe, to really try and distill out not only where the information is, but now the mission is to help people to use that information effectively, process, rationalize, and then as physicians, we need to make decisions, don't we? So
that's one of the most important things, to make the interpretation, how important it is, because you can have very nice algorithms. So Dr. Google can bring a lot of diagnosis there much better than we can do. But the interpretation of the patient information is quite an art. So that's something that we really will continue to need physicians for. And we need to realize what do we really need of physicians. And we need to focus our training on that aspect.
And I suppose this idea of immediacy of knowledge, but not necessarily immediacy of experience, which to some extent is what you're referring to, is part of what drove us to bring the Cytokine Signaling Forum together. It was the idea to try and put all of this new information into some kind of context. And I mean, again, you've been absolutely instrumental in helping us to try and understand what the interpretation of these now rather large number of trials that we have in front of us, exploring, for example, JAK inhibitors, new biologic cytokine inhibitors. What do you think have been the key successes in terms of CSF and indeed other online educational vehicles in helping people to place new knowledge into that decision-making context?
Well, one of the big advantages that you can do it at the moment you like to do it, and you can stop any moment and you can continue later. If you're going to a lecture, you cannot say, well, after 20 minutes I've seen it, I go home and I follow later on. So it gives much more well, you're really the boss of your own education if you have it in this way.
So there's a convenience factor. It's that 7-minute rule you talked about, the fact that people learn for periods of time and then diversify and then go back.
It plays a role, absolutely. So being your own master of your education is, I think, very important, very stimulating. And most of the people can do that very well, not all. For some we need some way to stimulate them or to convince them, but most of the people are quite well able to do so. So that's a very important thing for the success of this. And also I think the fact that you can pause wherever you want. If you want to see a slide with too much information, and we gave very bad examples in this seminar with too much information on a slide, but you can sit in your chair, you relax and you look at, you can increase it and you really can see what's there. And then you take those things from there that you want to see yourself. And sometimes the one who's explaining to you put focus on something you don't think too interesting, but other things you're more interesting. So it makes you more traveling the road than when you're just listening and looking at what the teachers show you.
I guess it's almost giving you ownership of your own educational experience, which presumably is very important.
It's the most important thing. So we see that people are getting more and more individualized, and that also holds true for education. But of course there needs to be some basics. So that's the challenge, I think, for especially medical educators at the level of different faculties. When you're in the stage of becoming a doctor, there need to be some things that you really know and you really understand. And it's not completely possible to leave that completely to the medical student. You need to set some rules. But that's quite some discussion, because if you ask me as a rheumatologist, I would tell, well, that's not so much important. Only when you have 50 hours of rheumatology, you will become a good doctor. And diabetes you can do in 2 hours. But my diabetic doctor friend will tell, no, you need 50 hours of diabetes and 2 hours of rheumatic diseases. So there are some challenges there, but we have to be aware, and we're trying to do that in the EULAR online course, which we're making a separate one for medical students, to couple it to real patient cases, which are intriguing, which make you interesting to see, well, what is it and what can we do about it, so that you need to stimulate people to work on smaller things. And then with the present possibilities, you can easily make some algorithms in a clinical case that if you want to know more about, for instance, arthritis, you can click and you go to arthritis. And then if you say, well, I'm interested in monoarthritis body, you can click further. And you can decide to do that today, or you can say, well, I leave that for another moment in time. But we have to be aware that we can make use of this and must try to stimulate the intellect of the students, but also the curiosity of the students, because curiosity-driven knowledge is staying better than other knowledge.
Yeah, curiosity-driven clinical practice is really that to which we all aspire, isn't it?
Yeah.
So lots of advantages, and you've laid them out very clearly. I guess one of the questions, though, one of the criticisms potentially that people might raise is about quality. And I guess we've all had the experience in the clinic of the patient arriving and putting down in your desk a great big pile of downloads from Dr. Google, and you read the first 2 or 3 pages and the heart sinks because there are 45 different cures for every disease, and why have you not cured me, doctor, because this website could cure me in a week. The quality of the source of information is critical. And I have to say that's something we thought long and hard about in the CSF forum in terms of bringing together people who really understood the field, but also understood the evolution in the field. How do you think we can measure quality in online educational resource? Because it's going to be very important going forward as it becomes the dominant vehicle.
Yeah. So I think we cannot say this site is not good. There are too many different sites coming up with all information, like you said, 50 different cures for rheumatoid arthritis, which we do not know about, but are out there in the internet. It's impossible to police that. That's not possible. So what we need to do is create, and we have done that with CSF, we have to create trustable, reliable places where people can go. So we try to do that with EULAR, we do it with CSF, but it's very important that you have people that are very open for education, but people that are not biased by that they want to reach some goals, because that's a danger. But if you have open, well-educated people who are realizing how important education is, and you involve them at this kind of educational tools, that's the way to go. But it will not be possible to give a stamp, because, for instance, EULA has been asked to give a stamp, that's a good website, that's a good web. We're never ever going to do that, because you have no control of that. Just make your own materials, be sure that you have the highest quality, and also it's important that you change every now and then, because it could be that one person is very good in 2000, but it doesn't automatically be the same in 2020.
So an evolving faculty and
Absolutely.
a constant vigilance to the content and the nature of the assembly of that content is what I'm hearing.
Yeah.
And again, in CSF, I feel pretty happy to be surrounded by a steering group of such quality. I think before we close, it might be quite interesting just to share a few insights that you've garnered. You've just stepped down as the president of EULAR. A little bird tells me you may even have retired from at least one part of your clinical practice in Utrecht, although I don't see you doing anything less than a full-time job in your days around the world at the moment, Professor Bijlsma. If you were just sharing some of the key jewels that you've picked up, particularly over the last decade, which has been an extraordinary time of change in rheumatology, what are the real key elements that you've picked up that you would convey to people who are interested in evolving and educating themselves for the next phase of rheumatology care?
Well, you mentioned rheumatology care, and I'm quite happy you mentioned rheumatology care and not research, because the most stimulating what we experienced in the last 10 years or something like that, being active in EULAR, is the commitment of many people in the field of education, in the field of patient care, in the field of research, not only by scientists and physicians, but also by the patients themselves. And I think EULAR made the decision about 20 years ago to completely involve the patient in everything we do. So the logo of the patient organization within EULAR is nothing about us without us. And we really do that. And I think we have learned a lot, and we have come quite far in combining that. And also the addition of the health professional is very important in bringing that forward. So that gives us the opportunity to have one common voice, which is very important if you will to bring things forward. And I'm also thinking about the political area, the public awareness, but also political area. So if you look at the European Parliament, for instance, they are voted on not by scientists or physicians, they are voted on by the patients. And the patients are a very important power in bringing things further. So we were able to adapt legislation in the field for RMDs, rheumatic musculoskeletal diseases, to improve possibilities. We were able to stimulate, for instance, cross-border possibilities for patients. We were able to get money allocated for research in the field of RMDs. So that was the most stimulating. And of course, we have been very fortunate in rheumatology. As I just mentioned recently, when I started as a rheumatologist, my waiting room was full of wheelchairs, and I don't see them anymore. So the progress that came from a lot of new drugs, so the combined efforts of people in pharma, the people in clinical care, has been very effective in the field of rheumatic diseases. But also, of course, the possibilities that our colleagues from orthopedic surgery have got to improve on to repair the joints. Though I was now recently attacked by our orthopedic friends that they say, well, you make us without any work because
I'm
you
delighted
don't
to hear
need
that.
those operations anymore. But still, the progress has been very good, and we've been very fortunate to be able to work in that area with so much new developments and so much rewarding developments in the past 10 years.
I must say it's really humbling for me to hear someone who has made extraordinary contributions over several decades in our discipline, who still has the patient or the person with a rheumatic musculoskeletal disease at the very centre of their thinking. I just think that's wonderful. And just as a final remark, Hans, if you would, what would be the one piece of advice you would give to a young rheumatologist just setting out in their career at the moment that you would wish to impart to them?
Be interested, be motivated. If you don't have the interest, it's not going to work. If you're interested, nearly everything is worthwhile doing it.
What a lovely bit of advice. I hope you've enjoyed this short discussion. It's lovely to, of course, have all of the glitz and the gloss of the CSF website and all that goes into it, but I hope it's also interesting for you to get an insight into the personalities of the faculty who actually shape the content and the core educational values that we're trying to impart. I hope this is interesting to you. It leaves me only to thank you, Hans, so much. That was fascinating. I really enjoyed that. Thank you very much indeed.
Thank you.